This information video discusses neutropenia and when to call the hospital should your child become unwell. Neutrophils are one of the subtypes of white blood cells produced in our bone marrow. Neutrophils are important in fighting bacterial infections.
A normal neutrophil count is greater than 1. When the neutrophil count is less than 1, your child is said to be neutropenic and may be at risk of bacterial infections. The lower the neutrophil count falls, the greater the risk of infection, as it lessens your child's body's ability to fight bacterial infections. It's important to remember that the medical team will advise you with specific information regarding your child, as every child is different and every treatment protocol is different. Chemotherapy kills rapidly growing cells, such as cancer. However, it can also kill normal, healthy cells. The healthy cells most affected by chemotherapy are the rapidly growing ones. This includes the hair cells, cells in the mouth and gut, cells made in the bone marrow, such as red cells, platelets, and white cells. One of the fastest growing white cells is the neutrophil. Your child's chemotherapy is usually given every 3 to 4 weeks to allow these good cells time to grow back. In children with ALL, maintenance chemotherapy is given continuously. The neutrophils are generally at their lowest about 7 to 10 days after chemotherapy. The length of neutropenia will depend upon the intensity of treatment. One of the main signs of infection is fever. A fever is when your child's temperature is 38 degrees or above. A fever in association with neutropenia may require your child to be admitted to hospital for intravenous antibiotics to help your child fight the infection. Neutropenia is the main risk for the development of fever and infection. Thus, it is important to contact the hospital if fever develops. Other signs of infection that may occur: chills and shaking, redness and swelling around central lines, ulcers, swelling, or redness in the mouth. This is known as mucositis. Redness around areas of broken skin, like a cut on a finger. Pain in the bottom. You should call your healthcare team if you are anxious, concerned, or feel your child doesn't look well. The single best way of reducing infection is good hand washing. Good oral hygiene, such as brushing teeth and using mouthwash, can help reduce infection in your child's mouth. Making sure your child showers or bathes every day is also important. Restricting people from visiting who are unwell is very important, but if it is a parent or sibling with a cold, you shouldn't need to send the family member away from the household. General hygiene in the home is also important, but you must not go to the extremes. It is important to know that many infections that children get during cancer treatment come from bacteria within their own bodies. Remember, despite your best efforts, your child may still develop fever and infection, which will require them to come to hospital. Good nutrition, exercise, and adequate rest are also important. Your healthcare team provides telephone advice 24 hours a day. As discussed, you should call immediately with any temperature 38 degrees or higher. Also, if your child experiences any of the following, you should contact the hospital: unexpected or significant pain, chills or shaking, bleeding from the nose, gums, central line or unexplained bruising, redness, swelling, pain or pus at site of central lines, unable to eat or drink for more than 8 hours, unable to pass urine for more than 8 hours, any rashes. Remember, it is just as important to call if you as the child's parent or guardian are worried or concerned at all, regardless of the time of day or night. Our team firmly believes there is no such thing as a silly or trivial question. There may be times when your child is unwell, you have called the hospital, and you are required to come to have your child assessed. When you are coming into the hospital, please remember to bring along your information folder and emergency letter given to you by your healthcare team. Some families feel it is a good idea to have an overnight bag packed at all times, just in case. If you live in a regional area, you may be able to attend your local hospital. When you call, the nurse or doctor will be able to tell you if you can do this. When your child arrives at the hospital, blood tests may be taken, and your child's central line may be accessed.
In summary, children with cancer require close monitoring during treatment. Febrile neutropenia is a potentially life-threatening emergency, and so maintaining close contact with your healthcare team is important. Any concerns or fears you may have as a parent regarding your child's condition should be communicated to your healthcare team. Remember, it is important to call the hospital if your child has a fever of 38 degrees or above, or you are worried or concerned about your child for any reason. Remember, neutropenia alone is not an indication to restrict your child's activities. Your consultant will advise on what restrictions, if any, are required during periods of neutropenia. Normal school and social activities are encouraged, and the importance of continuing to lead a normal lifestyle cannot be overemphasized. Please discuss any concerns with your doctor.